I love carbohydrates, by the way. I think they're the best like food group there is. And so cutting carbs, it's the most obvious way that you can lower someone's blood sugar, but it's definitely not the only way. And we're going to look at some examples of ways to eat carbohydrates that are sort of like smart and strategic ways to do so. So when I think about how to mitigate the effects of carbohydrates, I kind of have this framework that almost works out to be the 5 Ws. So it has to do with what type of carbs you're eating, who the carbs are being eaten with, how they're being eaten, when they're being eaten. The why, I sort of have a why. I don't have a where, but it almost works out. So let's start with what type of carbs are being eaten. So the best framework that I know of for comparing carbohydrates based on their quality is this thing called the glycemic index. The glycemic index is a system that basically ranks carbohydrates and sugars based on how quickly they're digested and absorbed, which also translates into how the magnitude with which they spike our blood sugar. The glycemic index was invented at the University of Toronto in the 1980s. This is a picture of me at my thesis defense. This is the inventor of the glycemic index. He used to like fall asleep and look around the room when I was talking, but that's okay. It was a pleasure just to interact and work with him. But it's interesting the story of how they invented this. So the story is they got dialysis tubing, which is permeable to glucose. They collected the saliva of everyone in the lab because saliva is a source of amylase, which is the digestive enzyme for carbohydrates. And then they took different types of carb and put it in their saliva mixture and measured the transfer of the glucose across the dialysis tubing, which is their proxy for like digestion and absorption. And what they found was that different carbs were digested, by the amylase at different rates, and then transferred into the bloodstream, so to speak, at different rates as well. So what the glycemic index teaches us is that something like white rice is rapidly digested and rapidly absorbed. It spikes our blood sugar. Our body releases a ton of insulin to deal with that glucose rush to then bring things back down to baseline. On the other hand, parboiled rice is digested more slowly and absorbed more slowly. You get a gentler rise in blood sugar. Your body then doesn't need to release as much insulin to bring you back down to baseline. So the glycemic index tells us white rice has a high glycemic index of 64. Higher numbers are bad and lower numbers are good. And parboiled rice has a lower glycemic index of 51. So all foods are ranked from 0 to 100. Again, like I said, lower is better. This is a little handout I give my patients, and I basically tell them, like, your low glycemic index are your staples. Those are the ones you eat every day and you eat pretty freely. Your medium ones you want to think about, be mindful of the portion size with. And then your high glycemic index carbs are just your treats. You can eat them. Sometimes you just don't want them to be your staple that you're eating every single day. The glycemic index teaches us like some very just interesting things. Like, for example, al dente pasta has a lower glycemic index than overcooked pasta or even just regularly cooked pasta. So if you undercook your pasta, it doesn't have the same effect. And that's, of course, how people would actually eat it in Italy. Boiled sweet potatoes have a significantly lower glycemic index compared to boiled white potatoes. And this is, you can tell I like carbs with like my focus here. Bow tie or farfalle pasta has a lower glycemic index than penny pasta. So even the shape of the pasta matters and changes your digestion of it. This is a study where they compared low glycemic load diets for people with poorly controlled diabetes to 2,000 milligrams of metformin per day. And what you can see is that being on a low glycemic load diet, and glycemic load basically means they're low glycemic index foods at a controlled portion size, lowered A1C by 1.04%, whereas metformin lowers it by about 1.38. So again, you can see pretty meaningful decreases in A1C for our patients. My pet peeve is when people use the glycemic index to villainize fruit. So this is like, I don't know, some troll on the internet posted this on like some lecture that I have up somewhere. And they're like, oh, great info, but you got to be cautious with fruit because sugar is too high and sugar is sugar, which we could have a whole debate about. But the point is, yes, some fruits are high in terms of their glycemic index. But I don't think this is the problem. Like, how many people are getting diabetes because they're eating so many overripe bananas, right? And I actually do know someone who eats whole watermelons, but that's not the average person. So I don't think this is the problem. And I think sometimes we focus on the wrong things. Okay, so that was the what type of carbs are being eaten. And now we're going to talk, this is like my favorite part. We're going to talk about who the carbs are being eaten with. And what I mean by that is like, what other foods are the carbs being eaten with? So first off, we know that if you eat carbs with protein, it lowers the resultant blood sugar spike. And the more protein you eat with your carbs, the better. So for example, if you have a cup of rice with 1/8 of a cup of black beans, your resultant blood sugar level, I'm talking about the peak blood sugar, goes down by about 4% compared to if you ate that rice alone. So not too much of a benefit. But then if you eat that cup of rice with 1/4 cup of beans, you get a decrease of 6%, still not that much. But check out what happens if you have 1 cup of rice with 3/4 cup of beans. Now you've decreased your peak blood sugar level by about 1/3. So I think that's pretty good. And other sources of protein do the same thing. So this is a study where they compared eating a slice of white bread alone to eating a slice of white bread with almonds. And what you can see is that it brings the peak blood sugar down by about 20%. So that's pretty good. You guys are gonna love this one. So if you eat macaroni alone, the glycemic index is 61. If you eat your macaroni with 4 1-inch cubes of cheddar cheese, you bring it significantly down. Again, because cheese, it has 2 things, right? It has protein and it has fat. So I'm not saying that macaroni and cheese is healthy. I'm just saying it does technically lower the glycemic index of those carbs. Even better, if you eat a slice of bread alone, your peak blood sugar is about 131. If you eat it with butter, you can bring that level down by about 13%, and you can lower the glycemic index substantially. So again, not necessarily advocating for this, but just so that you guys are aware of how all of these things work. And this is because different foods are digested at different rates. We know that carbs are digested the fastest, fat is digested the slowest, and protein is somewhere in the middle. So the idea is if you mix more of these things together, it just takes your body longer. Also, when you mix like carbs and fat, for example, those lipid molecules then like glob onto the starch molecule and the enzymes just can't reach it. So it just makes the body work harder and things take longer and the blood glucose spike is smaller. This is interesting too, and I'm going somewhere with this. If you eat vinegar with carbs, this also slows digestion and decreases the magnitude of the blood glucose spike. I remember people saying to me like, oh, like you got to drink your apple cider vinegar in the morning. And for the longest time, I didn't understand where that was even coming from or what people thought they were going to benefit from it. But there's something interesting going on, which is that vinegar, which is acid denatures proteins, right? And enzymes are proteins. So the theory is that if you eat vinegar, for example, you actually knock off some of your carbohydrate digesting enzymes. And in doing so, you can't digest those carbs as quickly. And then that also results in a lower blood sugar spike. Okay, continuing on the how are the carbs being eaten theme. That was who. Now we're how. How are the carbs being eaten? So this is a study that showed that if you eat carbohydrates before you eat vegetables, your blood sugar after 30 minutes is 225. But if you eat vegetables before you eat carbs, now you've brought that blood sugar spike down by 24%. We think that part of this is because of fiber. So we know that certain fibers dissolve in water. So when you eat those fibers, they dissolve in water and they actually form basically a gel inside your intestines. And that gel then traps the starch and glucose molecules, preventing them from being absorbed. But there's more. Dietary fiber also increases levels of this particular hormone, which is glucagon-like peptide 1, or GLP-1. And as we all know, GLP-1 minimizes postprandial glucose excursions. That's why we give it to diabetics, and it increases satiety. So the way I see it, dietary fiber is basically nature's Ozempic, right? Because we're doing the same thing. We're increasing GLP-1, and that's having an effect for weight loss. Yep. So in terms of the GLP-1 effect, I think it's all fiber, but I'm going to get into more of a discussion of soluble versus insoluble actually later on, because it does matter for certain things. But my understanding for GLP-1 is I think it's total dietary fiber. And this is a study that showed that the more fiber you eat, the more weight loss you have independent of calorie restriction. So this is pointing to the idea that indeed, it has some sort of other effect independent of like displacing other foods and stuff like that on promoting weight loss. And of course, the more fiber you eat, the lower your risk for diabetes. This is a dose response meta-analysis. And you can see as fiber intake increases along the x-axis, relative risk goes down lower and lower and lower. If we plot onto this, the recommended fiber intakes for men and for women, the chart right there. So you would have to actually eat pretty much more than what's recommended for a woman. And if you eat more than what's recommended for a man, you'll get additional benefits. Our fiber recommendations are highly criticized. People say we should be eating at least double of what, again, the Institute of Medicine recommends, because, again, these things are not always perfect. But if we plot on here the average fiber intake, it's a lot less. So there's definitely room for improvement when it comes to fiber. So I have this fiber guide that I give my patients. Basically, on one side, I show people what's the amount of fiber that's recommended based on whether they're male or female and based on their age group. And then on the other side, I show people basically how much fiber is in all of the different fiber-rich foods. And again, it's quite interesting because you know, most people don't know how much they need, and most people don't realize how much they're getting. And in a few seconds, you can kind of have a sense of what's going on there. Okay, so continuing along the theme of how are the carbs being eaten, this is another one that shows that if you eat carbs alone, your peak glucose happens 75 minutes after you ate those carbs. But if you eat oil or really any kind of fat before you eat those carbohydrates, now your peak glucose is 140 minutes later. So, and this helps you to feel full for longer, basically like 1 hour later. So things that reduce glucose levels. We've talked about vegetables, which contain fiber. We've talked about oil, and we've talked about vinegar. When I think about vegetables, oil, and vinegar, I think it sounds like a salad, right? So what this shows us is that basically our, cultural tradition of eating a salad, perhaps as a first course, is actually a metabolically good thing, because you're getting your fiber, you're getting your vinegar, you're getting, if it's a vinaigrette dressing, of course, you're getting your olive oil or your oil of any sort, and this is going to help decrease the effects of the carbohydrates that you're perhaps going to eat later on in the meal. I also have to hate on this for a second. Fat-free salad dressing bothers me a lot. It's the worst thing that was ever invented, because if you think about it, you want the fat on that salad, right? If you put fat-free salad dressing on your salad, now you're not going to get that metabolic effect of having fat before you ate your carbs. The other thing, and I'm not going to get into this in too much detail, but you need fat in order to absorb certain nutrients that are in vegetables. So if you don't have fat, you're missing out. It's okay. Don't eat fat-free salad dressing. Okay, so continuing on the theme of how the carbs are being eaten. Okay, this is like one of my favorite things. I only learned about this recently, and this has like even changed my own life. So it's not what you eat that matters. It's the order that you eat it in. So this was a study where they fed people carbs, protein, and vegetables. Okay, and they fed them rice for the carbs, they fed them chicken for the protein, and they fed them bok choy for the vegetables. And they're going to feed these things in all different orders. And we're going to look at how high the blood sugar increased after they ate them. So let's say you eat carbs first, you eat your rice, and then you eat your protein and your vegetables after. Your blood sugar increases by 66 milligrams per deciliter. What if you just eat them all at the same time, mixed together? Well, now your blood sugar only increases by 49. That's a 26% reduction. What if you eat vegetables first, and then the protein and the carbs? Now your resultant blood sugar is only 42 milligrams per deciliter higher. That's a 36% reduction. What if you eat protein first, and then the vegetables, and then the carbs? Now you've got a 39 milligram per deciliter decrease, which is a increase, which is a 42% decrease. And if you eat the vegetables first, and then you eat the protein, and then you eat the carbs, you get a 38 milligram per deciliter decrease, which is a 41% reduction. So this is really cool, because you're literally eating the exact same thing. You just changed the order that you ate it in. And when I look at this, I kind of feel like, other than like after these two, like I kind of see these ones as being basically the same. As long as you get like something into your abdomen before you eat your carb, you're getting a pretty good reduction. I think that's cool. This also teaches us that like the breadbasket appetizer is a very problematic social convention, right? This idea that we're going to have bread first is actually going to give us the biggest blood sugar spike. So you tell your diabetic patients, like, if you want to eat the like nice sourdough bread at whatever restaurant they go to, you just eat it at the end, or you put like butter on it. Just kidding, but you technically could. Yeah, so that's something to think about. Okay, this is good too. When are the carbs being eaten? So interestingly, you can eat carbs at lunch, the exact same amount of carbs at dinner, and your blood sugar spike is 20% higher at dinner. And breakfast would also be like pretty equivalent to lunch. This is because all of our hormones follow a circadian rhythm, right? So this shows you, if you look at insulin in green, you can see insulin levels are higher later in the day. That's because we're less sensitive to insulin. Our body has to release more to work harder. And this is why we shouldn't eat carbs later in the day, because our body doesn't want them then. When I think about it, I kind of like to use the car analogy. Humans are like cars, right? We need fuel. Carbs are our fuel. If we fill the gas tank before a long drive, it makes more sense than driving on empty and then filling the gas tank, right? So that's why you want to eat carbs earlier in the day before you go out and do all your work and physical activity. There's this cute little saying that I sometimes say to patients: eat breakfast like a king, lunch like a prince, and dinner like a pauper. It's totally counter to what we do as a society, but it actually makes a lot of sense metabolically. And you also don't have to follow this religiously. The more you front load your day, the better. Even if your dinner and your breakfast, they are the same size, and your lunch is the biggest meal, anything you can do to not make dinner the biggest meal is going to be helpful. Okay, so our case, back to it. 63-year-old male, he's still overweight. His A1C is climbing. It's now 6.8%. And of course, he comes in and he says to you, what do you think of intermittent fasting? These questions are always difficult, but let's talk about intermittent fasting or time-restricted eating for a second. So intermittent fasting and time-restricted eating means a lot of different things. So if anytime someone tells you they're doing this, you have to be like, what are you actually doing? Because different people do different things. So there are some people who fast for 16 hours a day and eat for 8 hours. People who fast for 18 hours a day and only eat for 6 hours. There's some people who eat 5 days of the week and fast 2 days of the week. Some people fast every other day of the week. So the point is lots of different protocols. Some I think can be strategic. Some I think are not strategic at all. It all depends on how it's done. But what I want to show you is this study. This is a study where they took diabetics. They had been diagnosed in the last 5 years. They had A1Cs that were above target. And they put them on a protocol where they ate all of their meals between 8 a.m. and 6 p.m. and they fasted for 14 hours overnight. This was for 12 weeks. They were instructed that they could not overeat. And what they showed was that 12 weeks later, just by narrowing the window that they ate at and having them stop eating after 6 p.m., their A1Cs went down by 1.54%. I think that's pretty remarkable, considering that they changed nothing else but the time during which they were eating. And to put that into perspective, that's better than metformin, right? We're actually getting a better outcome. Now, I will, again, you have to read the fine print and you have to read the tables. When I looked deeply at the results of this study, what you can see is that actually by narrowing their eating window, the amount of calories that they're eating did decrease. Not that they were telling them to restrict their calories, but simply like they couldn't have those midnight snacks. They couldn't have that extra serving, after dinner. So they weren't being told to decrease their calories, but they kind of inadvertently did. So it's not truly just an effect of time restriction. It's also what time restriction does to how much food we can physically get into ourselves. But I love this. I think this is very helpful for our patients. The last one, why are you eating carbs? This gets at emotional eating and stress eating and all of those factors that also contribute to the reason why someone might be choosing a certain food. I'm not going to spend too much time dwelling on that. I told you I don't have a where are you eating the carbs. I'll keep thinking about that maybe next time. But this is what I created again after my first week at Ghent Family Medicine, and I was like, oh my gosh, so many out of control A1Cs. So many things I want to tell these patients. How do I put it all into one place? So this is my 11 ways to lower blood sugar levels. It's still a bit wordy. I'm working on it. I think I'm going to make it more graphic, but for now, it basically outlines all the things I just told you guys. And then on the back, I have the glycemic index. So like I said, a little bit wordy, but usually what I'll do is I'll pick one, whatever I think that patient is going to benefit most from. I might tell them, here's the one that I want you to focus on. Maybe it's the eat more fiber-rich foods. Maybe it's the fast for 14 hours overnight. And then just call their attention to it and make it a goal for them.